Global Mgodie, realizing just transitions. Welcome to the German Climate Pavilion at COP30 in Belém.
So, hello, good afternoon, everybody. My name is Patricia Kramarz. I'm the Senior Advocacy Manager for Global Health at Save the Children Germany, and I'm leading of Save the Children's global work on climate change, global advocacy work on climate change and health, with a particular focus on UNFCCC. So, on behalf of Save the Children and the United Nations, our co-host, the United Nations University International Institute for Global Health, I would like to welcome you to our today's event, From Climate Negotiations to Resilient Health Systems. And I would a very warm welcome to everybody, and especially to our speakers who are here with us and bearing with us, because it's extremely hot here, so we are all suffering. And so I hope we will all manage. And before we start, just a few words to Save the Children. So Save the Children operates in 110 countries worldwide. And in addition to health, nutrition, and WASH, we work on education, child protection, and also anticipatory action. In the field of climate change and health, we delivered actually a range of projects already, and we have just started implementation of our Green Climate Fund projects in Malawi and Laos, which are the first projects funded by Green Climate Fund in the field of climate change and health in Southeast Asia and the WHO Afro region. So a few words also to our policy advocacy work. So here we focus mainly on the UNFCCC, on the global goal on adaptation processes. And together with our partners, the Young Lives study from Oxford University and UNICEF, we provided recommendations throughout the whole indicator development process. And to assure that the list of proposed indicators address the needs, the specific needs of children. And we just launched an updated policy brief last week, together with additional partners, with Youngo and UNFPA. And it's for the COP negotiations here. And if you are interested to get to know further details, just reach out to me, please. So now I will hand over to Revati Phalkey, who is the director of the International Institute for Global Health of the United Nations University, a long name. So Revati will be moderating the event today. So please, Revati, I will ask you to the hot stage.
Well, thank you, Patricia, for the warm, really hot, actually, welcome. And thank you, everybody, for putting up with us and with the heat. And really apologies for that. So I think we are, the objective of today's session is really pretty straightforward. The first one is, and I'm going to read this because I have to get this right. The first one is to understand the role of international climate processes in building climate resilient health systems. Now we know that Objective 16 of the Action Agenda prioritizes this work, and so we would like to discuss today with the panelists how can we achieve and how can we further the ambitions on that goal. The second one is, of course, to discuss particularly, and I'm looking at Dr. Nassef here, we are also looking to discuss the global goal on adaptation and the presidency's Belém Health Action Plan. And I know that Mariângela is online. I can see her on this screen. Hopefully, we're going to see her very quickly behind on the main screen to understand how both these processes can support climate action and finance, reaching the most vulnerable populations in countries, particularly at the national and the subnational level. And of course, the last objective for today will of course be how can we synergize the ambitions that we are requesting member states to make under the Belém Health Action Plan. And I know I have to get this right, it's the Belém Health Action Plan, as Mariângela would correct me repeatedly, and the global goal on adaptation. But how can these be operationalized at the country level? And to discuss this, before we go into the panel for protecting them from heat, we've decided to begin with our keynote today. And for that, I have the pleasure of inviting Dr. Katharina Stasch, the Director General for Multilateral Development Policy Transformation Climate at the German Federal Ministry for Economic Cooperation and Development, as most of us know as BMZ. Dr. Stasch, the floor is yours.
So, thank you very much. And dear friends, dear colleagues, it's a big honor to be here at this very important event. And thank you very much, Save the Children, but also UNU for organizing this. And for those of you who know me from my times as a PR in Geneva, I was already there very committed on the topic, climate and health. So this is why I'm very happy to really continue to push the agenda here also at COP. Now, we all know when temperatures rise and more natural hazards occur, it not only destroys our environment, it also makes people sick. And this is true everywhere in the world. It's true in the global south, but it's also true in the global north, and we are all in it together. And just to cite a few figures of the World Health Organization with whom I have been working very closely in Geneva, that climate-related health risks amount from their numbers to an additional 21 million deaths by 2050. Every death is one death too much, and certainly 21 million deaths are too many, too much. And this really calls on us to act on the global health crisis, which is also the climate change crisis. And it's also very true that the most vulnerable, the children, are those, again, most affected. And every day around 700 children under 5 die from preventable diseases worldwide. Diseases that are associated with contaminated water and food or inadequate hygiene and sanitation. And it's really our duty as the world community to ensure that children grow up in a world that is safe, that is healthy and sustainable. And for that, and you have said it, we need to invest more in resilient health system, in climate resilient health systems. And when doing that, we need to focus especially on children. And we need more information, for instance, how medication work on children. And we need to develop adaptation strategies. And we, as Germany, we are really committed. We are in that. And what is important for me, we don't only negotiate. Negotiations are important, but we act. And in the end, action is what we count. And yes, we stand to our commitment on our climate finance commitment, which is 6 billion each year. We reached that goal in 2024, and we even reached more. Counting in the private money, we have 11 or almost 12 billion euros on the climate finance. But we also need to be better, and now I'm looking because I have very concrete measures. We also need to be better in building infrastructure and invest in the climate resilient health systems. So this is about building infrastructure that can withstand extreme weather conditions. This is about training health personnel who are prepared for climate-related health risks. This is about developing medications and vaccines against climate-sensitive diseases that can withstand heat. And this is also about implementing early warning systems for epidemics and pandemics. So with this, I'm really happy and I'm really proud that we have this event today here at the COP. And I know there are more events to follow on this very important topic, but in a way this is to kick off the issue. And I'm very, very interested to hear about the new ideas, about how we progressed since, I think, 2 years ago when the climate and health agenda was launched in one of the COPs. Thank you very much.
Thank you, Dr. Stasch, for those wonderful and inspiring opening words, I have to say. And we also have to thank, so I'm ex-Save the Children. So the right side of me is speaking on Save the Children, on behalf of Save the Children, and the left side of me on behalf of United Nations University. But thank you for, the support that we've received from the BMZ. And of course, Patricia will echo my words for sure. This is probably the third time that we are doing an event jointly with you and at the German Pavilion with a focus on children. But, of course, we've expanded now into the work that we. I loved what you said, that let's make climate action everybody's business. It's no longer for a few to have that responsibility, and every preventable death is one too much. I think that is a very powerful message also for us. And of course, I also congratulate you on the role of Germany in terms of, not just overall climate and health discussions, but the advances that you're making in support of the global health discussions in Germany and outside as well. So thank you very much for those really valuable inputs. And with that, now I have the pleasure of moving into the actual panel. So stellar panel as usual, and I think I don't see Mariângela on the screen here, but my first speaker today is going to be Dr. Mariângela Batista Galvão Simão, the Secretary of Health and Environment Surveillance, the Ministry of Health, Brazil, Dr. Youssef Nassef, who is the Director of Adaptation Program at the Secretariat of the UNFCCC, but also the founder of the Resilience Frontiers Initiative. Then we also have Dr. Hendricks Mgodie. He's the National Health and Climate Change Officer at the Ministry of Health, Malawi. And then we have Oscar Garcia, the Director of Monitoring, Evaluation and Learning at the Green Climate Fund. Please, if I may request all of you to join us here on the stage. So I have to apologize to all of you. This rather looks like a very imbalanced panel. Flavia is going to probably shoot something at me very soon. But Mariângela is here and I'm also representing. Sorry. Brilliant. So I think I will begin with Dr. Mariângela. Dr. Mariângela, over to you. Please tell us, in terms of the Belém Health Action Plan, it will be one of the key strategic frameworks for climate and health, which will be launched. And we are hoping that, we can secure as many member states support or endorsement for the Belém Health Action Plan. Could you share with us your thoughts on how will the Belém Health Action Plan help mobilize global efforts to build climate resilience of health system, but also support the prioritization of the needs of the vulnerable groups that we wish to serve?
Okay, thank you so much, Revati, and thank Save the Children from Germany and UNU, UN University, for inviting Brazil to speak at this panel. I'll be in Belém tomorrow, okay? So I'm still in Brasilia, but I'll be there with you from tomorrow onwards until Saturday. Let me say that the Belém Health Action Plan has been discussed in many fora this year, and it has two objectives. The first objective is to strengthen adaptation and resilience to climate change, health system resilient, right? And the second is to put health in the health plan into, we have 3 lines of action, and we want to put this health plan in the agenda of countries and the future COPs, you know, and this goes by integrating it into the UNFCCC reporting system, the global stocktake, and so on. But the action plan, actually, because lots of people ask Brazil is leading on this endeavor, but it's actually complementary to WHO's Global Action Plan on Climate Change and Health, right? And also, we have actions under each lines in the plan, which is, let's say, there's more specificity on adaptation than the global framework. So one is global and it's going to be monitored globally. And the Belém Health Action Plan, we are working on a soft endorsement by countries, and it will build on progress achieved by the UNFCCC. It builds on the progress achieved by UNFCCC since COP26. You will have heard of the Baku coalition, right? Because 26 was UK, and then came the Emirates, Egypt, Azerbaijan, and now comes Brazil. And I understand we're still deciding where it's going to be next. So we are not talking about something new, but something that's actionable and that countries can adjust and adapt as they fit there, because countries have different burden of diseases, they have different contexts in health. And in Brazil, my home state in the south of Brazil just suffered a major damage because of a very unexpected tornado. And we come from a region where there's no tornadoes, right? This Friday. So climate change and climate emergencies are on our doorstep, and we need the health system to be resilient to it. I'll stop here, Revati, and I'll come back to you. So.
Yeah, thank you. Thank you, Mariângela. Well, thank you, Mariângela, for that input. We didn't hear you quite well, I have to say, but I did get a few bits, you know, that this is not something new that we are trying to propose. This is something that aligns very well to the ambitions that were agreed at the COP26 in terms of the health program that came out of there, the Attach program, and also the global plan of adaptation, global plan of action that was adopted in May this year. So I think that is what I got from what I heard. Thank you very much, Mariângela, for sharing that. Let me move over to Dr. Nassef. Dr. Nassef, from a UNFCCC's perspective, how can the global goal on adaptation support countries in building climate resilient health systems that reach and benefit vulnerable populations, and while doing so, also unlock the resources and the partnerships that are needed for effective implementation at the country level?
Thank you. Can you hear me? Okay. Thank you, Revati. That's a mouthful. It's a very long question, but and it's always a privilege to speak after the amazing Mariângela. I'll start by recalling a quote from Her Excellency Ambassador Stasch, which is every death is a death too many due to climate change. I won't say preventable, because they should all be preventable if due to climate change. And I think over the past couple of decades, we've misconstrued climate change to be merely a developmental problem. And when you quantify and monetize everything, people's lives become just an entry in a ledger. And insurance companies actually monetize the value of a human life in terms of how much the cost or the contribution of that life to the world could be. But I think where we are now, and thanks to the GGA in particular, is instead of viewing progress as something that's a measure of where we were yesterday versus where we are today, we're measuring where we are today versus where we should be. So the zero death is part of that landing zone. And it's a very different paradigm, because if you look at the GGA's health target, there are three elements there. One relates to achieving resilience of health systems, but the other relates to eliminating morbidity and mortality due to climate change. And it says significantly reducing, but we'll assume they mean eliminate. And the third is gaining resilience against climate change related health impacts. And from now on, these are already a structure that the MDBs have adopted, the regional development banks, and the NAP, the National Adaptation Plan guidelines, have adopted them. So it is becoming as standard a way of thinking as the SDGs have been up till now. And so it's opening a window for alignment. So everything aligns like the atoms on a piece of metal, then it becomes a magnet. And so I'm thinking there's a lot of synergy that will be possible now that the financial system, the support system, the planning system, the vulnerability and adaptation system on health would then be able to look at these landing zones as the guiding light, not just say, okay, this year we're 10% better than last year. That means nothing. And so that whole notion of being driven by a final landing zone, which includes zero mortality due to climate change, but includes resilience in all aspects relating to health, is, I think, one of the major components of the value of this global goal on adaptation. Many people think it's just about getting some indicators and that's it, but then they're missing the whole point. And I'll stop here and then give you more details in the next question. Thank you.
Thank you very much, Dr. Nassef. And really, I like the hope in your message. I like that, you know, these are strong words, right? That we're trying to standardize, we're trying to gain alignment, we're finding synergies between the finance systems, between how we are understanding the impacts of climate change on health, but also how we're going to respond to it. So thank you very much. And also another important point, that what is the landing zone? And I think that word really sticks at least in my head, you know, and I've heard you say that on an earlier panel in July here, actually in Brazil at the conference in Brasilia. And that's an important concept to make. Where are we all going? So thank you very much for that. So I will now move over to Mr. Oscar Garcia. What implications do the GGA indicators and the important areas of the Belém Health Action Plan have for the GCF and other financing instruments that are available to us?
Thank you very much, Revati. Good afternoon. Thank you to Save the Children, UNU, and the federal government of Germany for the invitation. For the Green Climate Fund, we really welcome the operationalization of the Global Goal on Adaptation and the Belém Health Action Plan, both. We think these are really opportunities to strengthen the channeling of financing where it's needed. The GGA indicators, particularly those related to climate-sensitive health risks, early warning systems, and resilient infrastructure, the three sets provide a clear results framework that can boost investments into these areas. This really provide a valuable foundation for measuring impact. And I think we should concentrate more and more on the impact, not just on the financing, but what is the result of all this financing in the effect on real lives of people and particularly of children, right? In terms of results within the GCF, we have a portfolio of $2 billion financing of direct GCF financing and $1.5 billion in co-financing across 59 countries in strengthening the capacity of health systems to anticipate, prepare, and respond to climate threats. So that's why we are really hopeful that the new GGA indicators will really improve access. From the GCF perspective, we had an integrated approach. We follow what's going on water security and link the importance of water security to health, food security to health, and then more specific health-related climate indicators, including the capacities of ministries to be better prepared in terms of capacity development to respond to this. Although we have some examples of climate resilient infrastructure, particularly in small island development states, but I will speak about that later. Thank you.
Again, thank you very much. You know, again, a message of hope. I mean, we've, I think, for a very long time, GCF has been very closely monitored for what percentage is going to health, and very happy to see that positive trend, you know, in the number of projects granted, and also the integrated approach. I think that's music to all public health practitioners. You know, if you're looking at other sectors or health determining sectors in terms of, you know, not just measuring impacts, but also responding. So thank you very much for that. And with that, I'll come for the first round with our final speaker, Dr. Hendricks Mgodie. So you are implementing one of the first GCF projects, you know, in Malawi. And I think what we would like to hear from you is, of course, your experience and approach in kind of strengthening the resilience of health systems from the Malawi perspective.
Hello, can you hear me? Okay, fine, thank you very much. I'm representing Malawi government, Ministry of Health, at the same time Save the Children International. Malawi, we're implementing the Green Climate Fund, and I'll just try to give a synopsis. We embarked on the concept note of the proposed development, and we had gone through several steps. And last year in October, the GCF board managed to approve our proposal funding, and we reached effectiveness this year, April 2025, to an amount of $37 million, targeting only 6 local districts in Malawi. But how did this work? Because of one, good policy set aside by the government, good coordination with the focal point Ministry of Environment and Natural Resources, even coordination with other CSOs, NGOs, and even we have got what you call deliberate policy in Malawi, like what you call the Health Sector Strategic Plan 2023 to 2030, which highlights in one of the thematic areas, climate change and human health is being a key area in mobilizing climate finance for Malawi government for 2023 to 2030. So it's like a strategic plan to mobilize finances. Also in the NDCs, health sector is one of the key priority areas in Malawi. Even the COP position country papers, health is being prioritized. In the NAPs, in the HNAPs, the vulnerability and adaptation assessments, we have done quite a lot. But all in one, there's a need of close collaboration with CSOs, NGOs, government to join efforts so that they can unlock the funds, and also with technical support from World Health Organization. But the issue, one of the biggest challenges is you need to identify an accredited entity to GCF. Otherwise, if you don't join up with an accredited entity, you cannot access the funds from the Green Climate Fund. That's one of the challenges where GCF needs maybe to simplify that approach. Secondary is the time which takes. We started the application 2020, but we reached effectiveness 2025 this year, and we have started. But for the past 5 years, 2020 to 2025, quite a lot have changed what was put in the design because of the time to access the funds. So there's a need of GCF also to simplify the period when the problems are there. They need to align with the period so that these problems are aligning with the government and the community, because the beneficiaries of the sufferer are the communities, the vulnerable community, which we need to save on time. So that is a very big So I'm happy Save the Children Malawi and the Ministry of Health were implementing a Green Climate Fund from 2025 up to 2030 to a tune of $37 and local. But this amount is not enough. We have got 29 districts. Out of 29 local council, we're only targeting 6 districts. So we need more resources from Green Climate Fund, Adaptation Fund, the Global Environment Facility, World Bank, and others to supplement on the interventions so that we we improve the living standard of our vulnerable communities in Malawi. But all in one final, what I'm trying to emphasize, if you want to unlock the funds, you cannot unlock the funds if you are working on your own. You need to be joined with CSOs, NGOs, government, and you should have priority areas in health and climate change as a government so that you can easily mobilize climate finance for health from different partners. Thank you.
Thank you so much, Dr. Mgodie. Yeah. So I think the message is loud and clear. I don't have to repeat it, and GCF is right here in the corner listening to all the simplification of the processes. And I quite agree, you know, having been part of that discussion with Save the Children, and Patricia is also here, I think it's a painful process. And I absolutely agree with you in terms of these things are evolving. And 5 years is too long. So I think your message is really loud and clear. Thank you very much for making that. So with that, we'll move on to the second and the final round of our questions. And I'll come back to you, Mariângela. 3 subsets. The first one is, what should COP30 deliver to advance climate resilience of health systems, or, you know, climate and health actions in general? But more importantly, what kind of actions do you think are needed after COP for accelerating the implementation of the ambitions that are being set here? You know, whether it's the Belém Health Action Plan, whether it's the GGA, or the alignment with the other frameworks. Do you hear me, Mariângela?
Can you hear me? I can hear you. Can you hear me?
Better this time. Please, go ahead.
Okay, good. Thank you. No, thank you for the question, Revati. You know, this is actually the scope in Belém under the Brazilian presidency. We are trying to work on an act, and the Belém Health Action Plan is actually one of the solutions in the broader COP30 agenda, right? And I always joke, but I'm actually saying it very seriously, because it feels like the world's going to end in Belém for us here in Brazil, and it's not going to end in Belém, right? Hopefully not. No, it's the beginning, official beginning of the Brazilian one-year presidency. So we need to make sure that the next steps are quite, like Dr. Nassef mentioned, are quite well set up, and that we do have country ownership of the Belém Health Action Plan. There are several countries still endorsing it, and those who won't endorse it won't be able to endorse it. Right now, we're going to work throughout this year, to make sure that everyone understands that that the plan is flexible, that it's monitoring the indicator. Our effort is to keep it simple, because right now I think there are more than 60 indicators. It's hard for countries to put that many indicators, right? So we need UNFCCC partnership as well, because we need to make this a task that countries do feel they own it, that they need to do something, but also that they can do it. If we make it too complicated, countries won't buy it. And then let me talk a little bit, because one of the things that Brazil is doing, Brazil has a climate agenda, right, internally in Brazil. So our national health system is called SUS, Unified Health System, because it works the same in the entire territory. We are a big country. So we do have the Adapta-SUS, it's an adaptation for the health system. There are other plans for education, for other public sectors, but Adapta-SUS is our own. In the next years, because it won't be over in a year, we will need to make it work for the Brazilian context. And we hope that other countries make it work for their context as well. I'll stop here, and thank you very much for coming to Belém, all of you. It's a beautiful city, challenging but beautiful. Thank you for coming.
Yeah, thank you so much, Mariângela, for those. Really, again, I think this panel is very, very positive and very hopeful. So I am liking the tone that all of you are setting. And I also like the word that, the world is not going to end in Belém. So absolutely agree. And of course, with the country ownership, I think you're right, that unless we make these global frameworks ours and we find synergies at, the work that we are doing at the country level, I think it's, again, these are frameworks. And I also love the final comment that you made was that we were trying to keep it simple. And I think that is probably a main message also, that, to keep, yes, we're going to operationalize all of these frameworks at the national level, but we do need to keep it simple and straightforward for the countries as much as feasible, and of course not oversimplification. So thank you very much for that. And with that, then I'm going to come over to Dr. Youssef. Dr. Youssef, same question to you. What are the key outcomes of COP30 for climate and health nexus that you would like to see? And of course, what are the key challenges that you foresee in the operationalization and the implementation of the GGA and its alignment with the other frameworks that are being advocated?
Well, perhaps I start with the second issue, which is the challenges, because one is operational, which is, we keep hearing that support for health is only of the range of 1% of total climate finance. At the same time, we hear from UNEP that adaptation support needs to go up tenfold in the coming 4 years. So adaptation support is already so low, and within that, health support is even lower than what it merits. So this is a huge challenge in front of us, and it also begs the philosophical question, because we keep saying, okay, all your projects must be bankable. You must be interesting to the private sector. What if they're not? Do you just accept the death? You accept, these losses? And I think there's a philosophical change that has to happen there. It's not just for health, but mainly for health, because of the sort of the existential nature of losing a human life. And so that change in mindset has to guide how we look at support. And linked to that, the whole notion that this agenda does not exist in a vacuum. It's human health is linked to planetary health. So there's a broader picture that you can't separate these items by themselves. It's about our relationship with nature, moving from an extractive to a regenerative relationship with nature. So there's a lot of challenges in the way of thinking, and how that translates into the ease with which we have ignored the sanctity of human life. And I think this is something that has to change and is part of our challenge. Now, in terms of COP30, there's a lot of very good initiatives that exists or are in the process of evolving, including the Belém Action Plan, the Attach initiative, the triple billion targets, the early warning for all from the Secretary General, the work, the analytical work done by the Lancet Council. There's so much happening all over the world. It's just not being addressed under one umbrella. And I think the GGA can be the place where all of these feed in. And then the COP can mandate the integration of the work of all of these under one umbrella, I think. This will be something I would like to see coming out of here as we move forward, also to address the challenges that I mentioned, one of which is the philosophical one is the operational one, the support one, but also the very difficult analytical or structural issue we have with trade-offs. So you have a title called health, but then under that, at what level are you doing what? What's at national level? What's at community level? What's in the middle? How do you deal with transboundary impacts? How do you deal with different demographic groups? Children are a very special group, but you have the elderly, the infirm, all kinds of other groups for which health means a different thing as you move around, and support systems have to be differentiated. It's a process of mass customization, as I call it. And so there's such a huge intellectual gap that we need to bridge before we can claim to have reached where we need to be in thinking about health and health support. And of course, there's a money gap as well that goes along with that intellectual gap. So I'll stop here.
I don't even know how to summarize that. So I think I'm just going to go with the 3 points, that proportions are important, right? That what proportion of the finance is going for health, what proportion, or, the trade-off thing that you mentioned, right? That what proportion of the health that you're going to address, and also in terms of how can we use the GGA, and you've said this even before, right? Like how does it align with the SDGs, but how can we use that as one of the options for integrating everything that we are anticipating to come out of this COP. So thank you, Dr. Nassef, for that. I know I didn't do justice to all the points you made, but I did my best. With that, I will move on to Dr. Hendricks Mgodie. Again, coming to the country perspective, how can the global goal on adaptation and the Belém Health Action Plan translate into resilience at the national and local levels without creating additional burdens for the already overburdened health systems?
Thank you for that question about the global goal adaptation and the Belém Health Action Plan. They are very comprehensive. I've gone through them, understood, and they are in line with our country priorities, especially the GGA. They are bringing a strength in trying to mobilize climate finance for health, especially because there are indicators which can provide evidence. When you are trying to mobilize climate finance for health, for resilient health systems, you need to have a justification and some evidence. In addition to that, even the Belém Health Action Plan is also supplementing that indeed health and climate change should be taken seriously in the UNFCCC, and it should be taken on board in the main agenda of all the COPs. If once the GGA and the Belém Health Action has been taken on board, then it will be very easy to mobilize climate finance for health globally at national level, but it will depend upon the country's specific priorities. For instance, the GGA, which are 10. Out of the GGA, which are 10, they are about mental health, climate-sensitive diseases, about infrastructure, early warning systems. But if you look on those things, there's one thing. I'm from Africa. Once we are hit by the climate shock extreme, our health infrastructures are destroyed. Once they are destroyed, what next? They will need to be recovered. They will need to be reconstructed. So if every year our health system is being destroyed and not being recovered, what are we addressing? So in the GGA, there is such a gap. It's not talking about recovery. You are losing the health infrastructure every year, but you are not recovering them. Then you are exposing the vulnerable community to the worst scenario. But the GGS have indicated, and the Belém Health Action, they will assist each country member state to mobilize, but they will need to cascade this GGA to their local situation, so that which is applicable to their problem which they experience. So I support very strongly the GGA, the influence it will have on climate change and health resilience. It is very, very important. And finally, it's going to influence health and climate change, the main agenda of the UNFCCC. That's one of our major targets. Thank you.
Thank you again, Dr. Hendricks, for communicating that with such clarity and really making your points great. I really like the sound of, using GG as the evidence for mobilizing finance, but also the importance of overlapping and cumulative impacts of climate change that health systems will face, and then what are we going to, and how are we going to understand and respond to that challenge. So thank you very much for that. With that, I'm going to come to our final input from Oscar. So what is the current status of cooperation agreements, such as those between the GCF, the Global Fund, the UNDP, and the WHO? how can these contribute to advancing the implementation of the climate and health measures at the country level? And there's a second element, that how can the lessons learned from accessing funding and implementation initiatives at the climate health nexus be systematically evaluated and leveraged to inform and improve policy and the programming processes that we see?
Thank you very much. No single country or no single fund can close the climate health gap alone. That's why partnership is so important. Partnership among countries and partnership as expressed in the GGA, and partnership among institutions. In that sense, yes, I really like what Dr. Nui mentioned in terms of the gap of financing for adaptation. And the GCF, the Green Climate Fund, is the largest source of multilateral climate finance for adaptation right now. And as such, it is committed to work on a partnership model, and specifically with the Global Fund, with UNDP and WHO. A formal memorandum of understanding between GCF and the Global Fund was operationalized in 2024, leading to a very important project pipeline, including in Malawi and Togo, with several other preparation in the Africa Centers for Disease Control, covering the DRC, Burundi, and Guinea-Bissau, and I can provide more detail about those operations. The collaboration with UNDP and WHO through the Climate and Health Co-Investment Facility is progressing well. When the program is formally approved at our next board meeting in March in 2026, a budget of 134 million will assist 15 countries design integrated adaptation projects that combine health systems, strengthening climate information systems, and nature-based resilient measures. So this is, in our view, the richness of a partnership model that includes many important international organizations, but also local organizations, as mentioned by our partner colleagues. And that's where, in our view, the learning comes in, from really systematizing what's going on at the project level so that we can link better the financing that is going to projects to the national prioritization plans on health, and through the transparency framework of the UNFCCC, have a better assessment of how individual projects are contributing to the global goal. And I think we need to enhance that transparency and also start learning more from those. And among those lessons learned, our experience in the Cook Islands and in Barbados in building climate resilient infrastructure, but also supporting the capacity development of ministries of health with a very important gender component of community engagement and community-based organization around the health facilities. It shares interesting lessons that can be shared with other constituencies in other countries facing similar challenges. Let me stop there. Thank you very much.
Again, fantastic contribution there. You know, the multi-country projects, I think that is really something that offers hope also for cross-country learning. And this is something that, you know, we've discussed even internally at UNU-IIGH, you know, that what is also the role of UNU in facilitating these kind of, you know, cross-country learnings and all the objectives. And also the second point about alignment, not just with national strategies, but also how, you know, the global goal on adaptation seems to be the North Star that we are all, you know, trying to align. But how can we bring those synergies between the three? So thank you very much for all your wonderful contributions. I think we do have time for maybe, we have 7 minutes, so maybe 1 or 2 questions if you keep your questions brief. So anybody who would like to ask a question to the panelists? Okay, so Flavia and then you. Yeah.
Thank you very much. My name is Dr. Flavia Bustreo. I was very engaged in inserting health in the early discussion on the Paris Agreement. And so 10 years ago compared to now, there is a tremendous difference in how much health is being discussed, and even with the limitation that you have met. My question is, how do we do in the next 10 years? Because at the moment, I see there are more discussion, more side events, more, you know, some projects, some beginning, but where do we take the next 10 years so that health is really within the main conversation and the main discussion. And the panelists you have here, they are very experienced of these processes. So I want to hear from them. How do we take it the next 10 years? Thank you.
So, should we take the second one as well?
Hi, so my name is Matthew Lindley. I work for UNITAID, which is part of WHO. And my question relates to looking at the supply chain and adaptation and resilience within that. It's really great to see the examples and the growing programs of work that are taking place nationally, but we also need to strengthen what those supply chains look like that cut across multiple countries when we're thinking about what are the health products and the health tools that we all rely on to ensure that we're going to be resilient.
So who would like to take that one?
Okay, let me start with the first question. I think we need to move away from a projectized approach. Project by project, I think, is really fragmenting the financing, and it's not geared towards achieving the transformation that we need in the health system to really be more responsive to the effects of climate change. How do we do that, right? It's really supporting the prioritization process of countries in platforms that put the international community and the local community around those priorities, right? And for that, I think the transparency framework of the UNFCCC, together with the new indicators of the global goal and adaptation, are a way forward. And I take the opportunity to also respond to the comment on the accreditation process of GCF. The good news is that GCF is going through an important transformation, and that we are this year have approved a simplified accreditation process that will reduce the accreditation time to 9 months. And that is really our commitment. And we hope that with that we can really move towards this more integrated approach.
On the next 10 years question as well, I think the default is to do more, faster, better. But the one missing link there, I think, is full cognizance of the implications of frontier technologies. How are we going to be using AI and the Internet of Things and robotics and advanced satellite technologies and all of that? We're still thinking in terms of yesterday's logic in trying to address health systems with certain assumptions about time and geography, etc. And all that has to be disrupted. So I think that will be a paradigm shift. From the supply chain question, I was wondering if you could repeat what the actual question was, because I couldn't hear it very well.
Hi, yes, so my question was, it's great to hear all of the different interventions which are taking place at the national level, but how do we take account of those projects that need to take place cross-nationally to make sure that we have a supply chain that works, say, from China through India to Africa or other parts of the world, that's really going to be fit for purpose and build our resilience and make sure that it's well adapted to those challenges. For example, I think the speaker from Germany, Katharina, she was talking about the whole issue of heat stability. And we can see that when it comes to heat-stable products, at various points throughout the entire supply chain, they are subjected to really high temperatures. And high temperatures, when it comes to things like, say, diagnostics, are really sensitive. So how are we going to understand the shape and dimensions of any health crisis if we're going to struggle to even understand who's got it and who hasn't got it? That's my question.
Yeah, so you've really covered a gap that is very obvious in the system, especially that the way we deal with climate action, both for mitigation and adaptation, is very nationally oriented. So anyone doing a national adaptation plan, there's that huge wall around the country, and nobody thinks beyond that, even though the world is globalized, and no regional level assessments are being done, no global level assessments are being done to respond to this, not only for aspects related to vulnerability, impacts, and adaptation, but even for mitigation and the whole transboundary aspects of things, supply chain, especially that we have the COVID experience where this was so obvious that instantly people lock the boundaries, and then their neighbors suffer because there were certain assumptions again that got disrupted, and we're bound to face similar things in the future due to climate change. So this wasn't climate change. Can you imagine if you add the climate signal, how much we'd need to assess the boundaries? There's a very interesting activity undertaken by the DHL Innovation Center. So they have this a room with a huge map of the world and all the current ships in all oceans, and they know what each one is carrying from where to feed into what. And the minute they can predict that there will be a storm somewhere or there's political problems somewhere else, they alert the company, hey, your product, your ingredient that's coming to feed into some product, a good or service, is going to be disrupted by 2-3 days, and they have to take action against it. Unfortunately, we have that in a very limited context, but we need that to be comprehensive for the whole world to understand the vulnerabilities that are transboundary, whether through supply chains or otherwise. So definitely a huge gap in the system, a huge gap in our thought process. Mm-hmm.
Fantastic. I think with that we're going to close, and I will hand over to Patricia to say a few words.
Thank you very much, Revati. So I will keep it very, very short, not to torture our speakers anymore, because it's extremely hot up here. So first of all, I would like to thank you all for the great discussion, and on the very positive note, and also good to hear the good news from the Green Climate Fund. And we are also very much looking forward to the agreements reached on the GGA at this COP. So I think we're all very excited what the outcome will be. And so I can just say that Save the Children is really ready and happy to work with all of you on this and to really operationalize the GGA on country level. And for this, I would also like to thank our audience online and also here in the German Pavilion for being with us and bearing with us. And a special thanks to the team of the German Pavilion for hosting us and for being so supportive. They are really suffering the heat since days, and they did an excellent job. So thank you so much, everybody, and we're looking forward.
Global Mgodie, realizing just transitions. Welcome to the German Climate Pavilion at COP30 in Belém.